Hi, my name's Heather. My husband and I have been going through infertility about 4 years now, and we just had our 4th IVF transfer. And I want to go through some questions that I'm getting from y'all. Being, do you test before your beta? Yes, I always test at home. For me, I would just rather have the news in the comfort of my own home prior to going in. How many embryos did you transfer? One. We've only ever transferred one. That's what our doctor recommended. She told me that the chances of pregnancy only go up by a few percentage points versus the chance of having multiples goes up by a lot. And I know that sounds kind of weird, but she is under the thought process of let's use what we have and be very strategic in like changing my protocol each time. So if this doesn't work, we can change things up. We're actually posting in real time. Yes. Is your diagnosis? Is there any male factor? Everything's always been unexplained. Nothing has ever come back that has told me that there's anything that I need to fix. I've never had any lining issues. I've never had follicle issues. Can you give us a quick journey recap? Yes. So 4 years ago-ish, my husband got back from a year tour to Korea and we said, we want to start our family. We wanted to start it earlier than that, but between his schedule with the military and obviously him leaving for Korea, we postponed. We tried for about a year and a few months. And then I was doing some at-home tests, like the modern fertility test. Everything was coming back normal. I went in to see an infertility specialist. They said, you know what, we should do IUI. Like everything seems great, but you may just need a little bit of help. 4 IUIs later, we also did like SIS, hysteroscopy, letrozole, Clomid, like tried different medications, did a trigger shot each time, and those didn't work. So they recommended IVF. So that is where we're at in the process. We did an egg retrieval last September. So it's been almost a year. And our first transfer was fresh. We ended with 5 embryos. Our first transfer was fresh. We have had 3 frozen transfers since. I have a hysteroscopy next week. How were yours? They put me to sleep for both of mine. I know some people said that they were awake. I don't know how y'all did that, but I was asleep for both. I felt just a little crampy, like bad period the day after. Like I just felt like I had my period pretty bad the day after, but outside of that, fairly simple recovery. I was in and out. It's a very quick procedure. When you do PIO, do you pull back a little bit? Yes, we always did. So when you do the PIO in your behind, you're supposed to put the needle in and then just like pull out a little bit. And you're supposed to make sure that you're not, my understanding that you haven't hit an artery and you're like pulling back blood. So you just want to make sure there's no blood when you do that. Things to avoid during the 2-week wait. I just like to pretend, and by pretend, I mean, I like to just say I'm pregnant and do the things that I would do if I was pregnant. I would say like, as far as activity, I try to just kind of limit myself and not go crazy. But yeah, as far as like limiting caffeine, and just making sure I'm like fueling my body the best that I can. Did you do PGT testing? If you didn't, why? How did you decide? I'm struggling with this decision. Lots of questions about the PGT. So we're military, went through a military hospital for our retrieval. I learned a lot during that process, a lot of things that I didn't know. Obviously, I didn't know anything about IVF, especially doing it through the military. We were told that we were not allowed to do testing, PGTA testing, which basically tests the embryo to make sure that it's genetically good. Both of us were, we did genetic testing, but we did not test our embryos. At a later time, once they were frozen, I asked our doctor, we transferred to a new hospital. I said, is it worth me thawing, testing, refreezing these embryos? And she said no. And so we went with what she recommended. She said that also it's not a perfect science with testing, because if you test and it says it's 100% great, it's great. If you test and it says it's a lower quality, she's like, basically you're testing the outside cells, not necessarily the inside, and the outside isn't super happy because it's not in your body. It like wants to be in there, you know? And so she says sometimes you can get into a situation where you're throwing out embryos that are bad that could potentially, there's so many schools of thought with this. Honestly, if we have to do another retrieval, I don't know what our decisions would be. I think you need to do what you think is best between you and your doctor. And like I've had people message me saying that they did test and they used all of their good embryos and they all failed, and then their not good genetically tested embryo was the one that worked and it was like a perfectly healthy baby. So I know that there's 2 ways. I know I've kind of beaten myself up sometimes and felt guilty for not being able to test and like not pushing that. But at the same time, I also feel good, like, yeah, lots of emotions with that, I think. Do you have to travel back for your beta? No, all of my other tests would just be here. I don't have to go anywhere else. Do a saline sonogram. When was that suggested? We had to do that. I think they called it an SIS. I had to do that prior to, I had to do an HSG and an SIS before our IUIs. Or maybe I did like 2 IUI, like HSG, couple IUIs, SIS, couple more IUIs, but it was in the IUI process. What was your HSG experience? Everybody freaked me out, told me it was gonna be the worst thing ever. Some people told me they passed out on the table. They prescribed me some hard medicine and I was like, that freaks me out. I'm not gonna take that. And she was like, you need to take something. Like you need to take some Tylenol, ibuprofen. I took both, like the max that you can take for Tylenol and ibuprofen. It was a little crampy, but it was fine. Then I went in for the SIS, the saline sonogram. And I didn't take anything because nobody said a word about it. And that was probably some of the worst pain that I've ever been in. Curious why your protocol didn't call for bed rest. Lots of questions about that and just like what to do after. I have asked my doctor, I've asked multiple doctors because we've had a few throughout this process. Everybody has told me not to do bed rest. I know that that's different for other people. I think it really truly depends on you, your body, your doctor, what you're having done, your protocol. Like there's so many different things. For me, I like even asked again, I was like, what do you want me to do? And she's like, I want you moving. I want you up. Like, we need to be getting blood flow throughout your body, do your uterus. Like, I need you up and moving. She said the only day was like the day of transfer. She's like, I just want you to take it easy. Like, I don't want you to really do a workout, but I want you to go for a walk. I want you up and moving. She's like, the day after transfer, do whatever you want. Like, you can work out, you can do all the things. So I haven't really been working out. Like, I'll do some light, low impact things. I've been doing yoga, really just like listening to my body and what feels good. The pyo shots that bad, and why aren't you doing them? They're not that bad. Like, they're pretty bad. But I feel like people really scared me about them, but they're not, like, once you're in the routine of it, you're like, okay, like, it is what it is. Did I dread it every day? Yeah. But also was I like, this is helping me get my baby and it's good for my baby, so I'm gonna keep doing it. The things that you'll do, you'll just do anything they tell you to have a baby. I'm not doing them this time because, so I've done mostly, my first 2 cycles were medicated frozen transfers, where I don't really rely on my body's cycle. I take birth control and then they kind of time my cycle. And so my body isn't naturally producing the things because I'm not using my cycle. With this time and last time, I did a natural modified, which is using my body's natural cycle. And I looked this up just to make sure I was saying the right thing. So with a medicated cycle, no corpus luteum, very little natural progesterone. With a modified cycle, because I'm using, like, I grew a follicle, that follicle turns into, from my understanding, the corpus luteum. The corpus luteum is what is making the progesterone. So your body is producing the hormones from the corpus luteum that supports early pregnancy. So because my body was naturally producing it, I didn't need to replace it and do pyo shots. I could just supplement with the suppositories. You know the gender of each embryo? No, because we did not do PGT testing. So if you do test, they will tell you what gender. Deciding to do IVF, how many months did it take to start? This can be very different. I called a place here in Florida to just kind of ask questions if we had to do a retrieval here. And they said I could be doing a retrieval within 2 months, which was crazy to me. The process to go through the military, I'm not joking, took almost a year. Like, from the time that we decided and getting on the wait list, it was about almost a year. The hospital in Florida that we were at prior doing the IUIs, they quoted us like 4 or 5 months-ish. Did you get coverage through TRICARE? Because we went through a military hospital, it was significantly discounted, and then all of my monitoring appointments are pretty much covered. A big portion of certain medicines are covered. When we did IVF, those medications, that was like through their, like, Brooke Army Medical in Texas is one of the 7 or 8 IVF clinics that TRICARE helps with as of right now. Hopefully there will be more, but the package for that included all of the medicine. As far as like the IUIs that we did, TRICARE didn't cover any of that. It's like monitoring appointments, some medications. It covered the SIS, the HSG, the hysteroscopy, like those procedures were covered too. If you could go back, what would you do differently? It's a hard question to answer because I just feel like everything I did was the best. Like, the Heather that I've been along the way, she was just doing her best. And so I don't know, probably start the process sooner, knowing how long it has taken. How do you not let yourself fall into the deepest darkness? My husband, he's amazing. Prays for us every single day. Just like leaning on my friends and family and having a really good support system, and making sure that I like get out and keep living, and not allowing myself to feel the feelings, but then also knowing like, okay, you gotta stop this and you gotta get up and keep living. How many retrievals and how many embryos? I've only done 1 retrieval. We had 27 eggs. I almost went into the what's that called? The hyper ovulation syndrome. And we ended with day 5 embryos. Have you ever had your husband checked? Yes. We've been through the ringer with tests and all of the things. And like I said, everything's come back fine. What was your protocol this time, and why are you taking Claritin? So they changed things up a little bit this time. I started with the letrozole. So I started my normal cycle. On day 3, I started taking letrozole for 5 days. And then that's to grow the follicles. And then that was it as far as medicine for that, obviously my prenatal. And then this time, this was like a low histamine, low inflammation protocol. So she had me on 81 milligrams of baby aspirin, which can improve blood flow to the uterus, also can potentially help with recurrent implantation failure. And then I took Medrol, which is like methylprednisolone, which is a short course steroid to reduce inflammation, temporarily suppress parts of the immune system around time of embryo transfer. Doxycycline, an antibiotic given to reduce the risk of introducing bacteria into the uterus during transfer, or any low-grade bacterial issues that could interfere with implantation. Basically, if I had an infection, that would clear it up. Claritin is an antihistamine, often used as an antihistamine protocol to reduce histamine-related inflammation. Pepsid AC, although it's commonly used for heartburn, it also blocks histamine signaling in immune cells. Together with Claritin, it provides broader histamine blockage, and then obviously progesterone. Biggest tip for retrieval and transfer? Prior? I would say for retrieval, my husband and I both really tried our best for like months leading up to the retrieval to take care of our bodies, because we just heard like how much that can really affect your retrieval. So as far as like our diet, obviously limiting caffeine, limiting alcohol, like just making sure, like moving our bodies, working out, doing the things. We took a lot of different supplements. I can share those with you too, but the doctor that we did the IUIs with gave us a lot of supplements for like CoQ10, D3, fish oil. There were some other like actual fertility supplements for Nathan, for myself. Took consistently for like months leading up to the retrieval. Giving yourself a lot of grace, knowing that everybody handles these things differently. I think I went in thinking one thing, I came out thinking a completely different thing, because just social media and everybody like makes you think one way, and then like you handle it physically, emotionally, mentally differently. And so just having grace for whatever that looks like, if it's like 10 times harder for you than you thought, or like the easiest thing ever, just like knowing that you're going to handle it differently.